Technology, business, multimedia, wellness and health, events, reviews, and more.
This is Mary Collins from Life Hacks Media on Radio X, and I am back with Dr. Akawi, our specialist vet, and with also wonderful medical advice for humans as well as their pets, especially during this pandemic, COVID-19. And now we're going to discuss the aspects of our pets, because this was the whole thing. You know, I'm looking at these 1918 pictures of people wearing masks and their pets wearing masks, and I'm like, oh, is this necessary? It's a tender subject, because I love my pets and I love animals, and I don't want people abandoning animals because of this.
Unfortunately, this is part of why I like to talk to you today, and I always try to be proactive, spreading the right information based on the American Veterinary Medical Association, the FDA, the CDC, the WHO, International Animal Health Organization, that there is no risk. Again, there's no risk, underline, big double underline, so far, that our pets can contract and spread and get infected and or make people infected with the virus, despite what we have. I mean, we have 4 cases that is reported so far. One, obviously yesterday, the tiger in New York Zoo.
Right. Yeah. What is that about?
Exactly. There was an actual worker that worked there that was infected. The zoo was closed in mid-March. And came in contact with the tiger. The tiger was showing upper respiratory tract infection. They tried to treat him. And because the worker was infected that was feeding him, they thought they will test him. They did the same test, the RT-PCR test, and the tiger was positive for the coronavirus. So it was treated. A bunch of the other tigers tested negative, although they were showing signs of upper respiratory, but they were all okay. So that's one case. And there's a case of 2 dogs in Hong Kong that tested. One of them was a Pomeranian, 17 years old. Tested positive, but there was no clinical signs. One cat in Belgium.
Wow.
There's a questionable, the test was questionable. They tested the material from the cat, vomit and poop from the floor or something. So it was, but the bottom line is none of them, except the tiger, showed signs of the virus. But just to emphasize, Waltham and Royal Canin, 2 big companies in IDEX, has been testing thousands and thousands of sample as a precaution from pets in the last month or so. And there was 0 positive cases from pets. And there is no clinical signs, even with pets that their owner tested positive for coronavirus. So to put that in perspective, we have like 1.367 million people in the world testing positive. And if you want to extrapolate, maybe there's more than that are positive without being tested. And we have 4 cases, four measly cases that show, the animals can get the disease. Those are not enough. There's no enough data to say that pets are could
carriers
or carrier. And this saddens me, because we do have a lot of increase recently in the giving up the pets to the shelters. People are giving, based on false information, giving up their pets, and or a lot of clinics are reporting increased inconvenient euthanasia of their own pets, because they're thinking, well, it's probably, I don't want to take a chance. So at this point, there is no evidence for that. But we have to be careful. If you're positive, if you test positive for corona, you shouldn't be interacting and sharing food with your pet. because we don't know a lot at this point. So
well, I mean, not that they've said that there's proof that it came from a bat. I mean, there's that debate about, did it come from a bat? Did it come from a lab? Nobody knows. But it's like this whole tiger thing. How did this tiger get it? This is and if the tiger can get it, and that's not even near our species, like apes could definitely get it, because I know, speaking to the zoo, that they get influenza every year. They do, like humans.
Not only they get it, they actually did study on macaques. Last week, I read study. They were doing it to see if macaques, after they recovered, which they all recovered, but they wanted to take blood sample and see if they have protective antibodies against that, and they found that they do.
So, well, then that's a good thing.
Yeah, that's the closest species to what we have.
Right.
And they even, went back and looked at the MERS and the SARS. There is immunity that we can develop. So they had collected, and they were saying maybe that blood samples were collected from 200 cats, feline, before the infection spread. And they put them in a laboratory for 4 months. And then after all this, they retested those cats again to see if something happened. Then none of those cats that had a sample prior to the break in the pandemic, they have no signs of upper respiratory tract infection. So they retested them after that, and 15% of the cats showed positive antibodies for the coronavirus. What does that mean?
Yeah.
It means they developed immunity.
Right. Without even showing.
Exactly. Yeah. Any immune system is challenged with any virus or bacteria, for that matter, will develop antibodies. That is not correlated to infection, nor it is correlated to carrying the infection. It's just a fact that those guys got immune. They didn't have infection before. They didn't have infection or signs after. There's no evidence that some of them actually were isolated in a shelter. They were just studying. So they did the same thing with some ferrets too, ferrets and cats. So you may hear some of that. I'm just saying it because...
Yeah, well, it's good to know, because maybe that's another good reason. Keep your pet around, because your pet might be that bit of help with the vaccine that we need,
Exactly.
Because they can process things a lot better than we can.
But again, we were just talking about how can you prevent, try not to be selfish. How can you prevent, if you have it and you touch your dog indiscriminately, including the collar and the harness, and you love and kiss and
let them jump up on the couch and on the bed and everything.
And
there
then
needs to be some policies in place. Yeah.
The pet sitter comes in and touches that, or your vet. You take your dog to the vet and they touch that. I mean, this is how you have to be careful. It's not the pet carrying the virus.
Right.
That stuff that is on the pet, their sweater and their jacket and their collar and their harness. And actually the virus, if you are infected, will go on the hair coat. But the good news is, I said it's more serious if it's a cardboard or a plastic. If it's fabric or hair, the virus get trapped in the hair and cannot come out of it.
Right.
But it's going to be a third object that can transfer that.
Right.
So if you are infected, isolate yourself for 14 days. Don't handle your pet. Let your cousin or your sister or somebody else handle your pet until you go through that and you are not infective anymore. You're not shedding that disease anymore. If you're not, then still precautions. I wouldn't
Well, what I've seen, which is hilarious, is people who are like meeting up, because they're still pretty lackadaisy over here, and they're like 6 to 8 feet apart, yippee. But then they have these long leads, and then letting their dogs kiss, and sniff each other's butts. And I'm like, really, common sense, like even if you went out for 5 minutes That's all it takes. And then also, I'm sure the same people are also going home and the dog is just running right in and they're touching a million things in their kitchen before they actually take the collar off or do any of these things. And I actually, because I love my dog and my cat, and I'm really thinking about this as they're my children. One of the things that you have to do is just be sensible. So when we come through the front door, everybody gets a little bit of a non like 70% ethanol mixed with something else so that it doesn't do damage to, or vinegar, so it's just or just soap and water, baby wipes that you just rub on the pet's paw, and you take the collar off, and then you do the same on the collar, and you put the collar and the lead down, and you let the dog hang about there with that stuff on for a minute, 30 seconds at least, before you let them tramp through the rest of the house. And then there's certain things that are restrictive now. The couch, there's no going on the couch, there's no going on the bed. Give them a snuggy area that they can lie in that still has whatever essence of you that you need it, so that it doesn't feel like it's being excluded from the couch or the chair or wherever. And just use your sense so that you don't give the dog or the cat, they don't get blamed because of you see this so much in the world. People say, well, it's my right to do this and it's my right to do that. Well, it's your right to be preventative. That's the biggest right of all people need to realize they should have, is stop something before it becomes a problem.
Exactly. So really, the summary is, and it's okay to go outside by yourself, walking your dog. I mean, you need the exercise. That's actually stimulate your NRF2 pathway too, which is for immunity, and the sunshine for vitamin D3. But I wouldn't let anybody touch my pet on my walk, because I don't know if they have it or not have it. If they have virus and they are asymptomatic and they petted my dog and they transfer virus into my dog, then I go ahead and pet my dog, then potentially I could be exposed to the virus. I mean, it's not the dog having the virus. It's something on the dog
just
coming
like a
from
surface.
somebody else. Yeah, it's like being in an elevator or being in, and it's the same thing. We already said the virus can live on fomite for about 24 hours. So if your dog has a sweater and somebody came and petted it and they have the virus, even though they are asymptomatic, guess what? You're going to pet the dog or take that sweater off. You could expose yourself to that. So that's where the danger is. It's not the dog or the cat having the virus. We don't have any evidence that they can get it internally and carry it and give it to us. But something on them as a fomite, like a table or a sweater or a collar or a harness, those are the things that if they are touched by a third party, then you are touching them, or your son when you come home, or who people don't even know they can expose themselves.
So what are the best techniques if you've gone for a walk, whether you're by yourself or with a pet or with a child or whatever, with your partner? What should you be doing the minute you get to your front door or garage door? What's the procedure?
I would put my clothes in the washer and dryer.
Right. So that's what I'm super paranoid. So that's what I literally get through the front door. The neighbors must love this. Get through the front door, strip pretty much the outer layers, at least jacket, shoes, right? And if possible, have a pair of house pants at the front or shorts, and then just take it off, put the other stuff on, wipe your hands in between, put the other stuff on, put the stuff that you've worn out into a plastic bag, tie the bag. Yeah. Put it in the corner, and even keep doing that, I guess, until it's enough that you can then go and wash everything together at a certain temperature. Those are just, I mean, it doesn't necessarily guarantee anything, but it definitely is preventative, more so than doing nothing.
Further, if you use the washer, you're using soap. Remember, we said soap kind of disable and activate the virus. Then you following that with the heat in the dryer. Even if you just did the heat, you didn't wash it. Heat will inactivate the virus too. Now they're doing this with the masks in New York City. Of course, they're adding hydrogen peroxide is an antiviral too, because again, what does hydrogen peroxide does? Saponation. It kind of breaks the fat molecules, and it including the crown of the spikes and the capsid of the virus. So they're using hydrogen peroxide in evaporating it, just like in a dryer, to spray the masks and reuse them again.
That's actually what I use on the stuff that I have as well. But is 3% hydrogen peroxide enough?
So it's 5 is what they recommend. 5%.
Okay, 5% hydrogen
peroxide on the hair.
Right. So you can't spray your clothing with it because you will end up bleaching your clothing. But what about use on skin? Can you spray or use hydrogen peroxide?
As long as there's no open wounds, because the thing is, if there's open scratch or wound, it bubbles, it kills the superficial tissue. If there's no open one, I would dilute it or mix it with, if you get the higher concentration, with saline or water to make it less irritant, but more effective.
What are some of the treatments? Because that's my biggest worry, is that am I going to kill my dog accidentally by spraying something that's toxic on the bottom of their paws? So what are some of the ways to clean quickly when entering the house after being outside?
Well, the best thing that we know of is a solution called chlorhexidine solution. It's a 2% chlorhexidine. You can buy that at the pet store. It comes in big, gigantic thing. You can dilute it and use that. That is, we know it kills the virus or inactivate the virus. And we know it has secondary antibacterial, antifungal, anti-yeast. And it is safe to use on the paws and the skin. We actually use that to clean the ears with. I mean, that's how safe that thing is.
Okay, so is vinegar another, like if you don't have that or your pet stores aren't open, what are the alternative homeopathic or not homeopathic? What are the natural ingredients that we can find in a supermarket that we can use to also clean surfaces or hands that are safe on hands and paws?
The tree oil is excellent too. Again, you can combine that with other carrier like saline. I mean, you can dilute it. You don't use too strong one. Witch hazel is another thing you can use.
Oh, okay. Because I was worried about the tea tree with the cat, because apparently their metabolism isn't as good to process things like tea tree.
Cats are like completely different. Chlorhexidine is safer on cats. Hydrogen peroxide is safer on cats. But essential oil in general, they don't have the necessary liver enzymes to metabolize the essential oil. Plus, they concentrate things more. So I would definitely not use any essential oil
on the cat.
Cats.
Okay, so that's your life hacks to know that with pets, be careful, because a cat and a dog have completely different metabolisms, and what works for a dog for safety, like maybe a little bit of saline solution mixed with a tiny drop or two of tea tree to just kind of break down COVID or other bacteria and viruses, will not necessarily be healthy for a cat, because tea tree is just too strong for their metabolism, right, Dr. Akawi?
Yes.
So something different so is vinegar strong enough to break down?
Vinegar,
You should think it should work.
White vinegar in particular.
Okay, is there a reason why? Is there a difference between brown vinegar and white vinegar?
It's more strong as a disinfectant, and it has less lactic acid in it.
Okay, but obviously be careful. You can still blind someone from spraying vinegar. So just maybe spray on a wipe and then wipe the paws.
Yes, I never use anything directly on pets. Always use the wipe. You can make your own wipes, actually. The same way, saturated, maybe diluted with the cat than a dog. Dilute it a little bit and then use wipe, and then use the wipe on the pets if they go outside. Obviously, cats are, not as much. Some cats go outside, but a lot of cats are inside cats, so they don't have as much exposure except you as a person. But peroxide is safe to use, and chlorhexidine is extremely safe. Vinegar is safe. Some of the, I was reading yesterday, some of the cleaning products, they tell you on the label, read it, whether it's safe for pets or to use around pets like Pine Sol and things like this. Just look at the label, and if it says it's by the company,
Right.
it's okay to use, then some of those products can be used.
Okay, so that's the most important thing, is don't go crazy and do what I'm doing, which is bleaching everything. Try and be sensible about it, and remember that if you are going to bleach the floor or use Pine Sol on the floor, what the effects might be to your lungs and your pet's lungs, because those sorts of things are very strong. So maybe do something a bit milder, like with vinegar, white vinegar, and just be sensible.
This is what you should be looking for. They're saying if you clean a surface with Pine Sol or hypochlorite or something like that, you want to be visibly able to see the surface wet for 4 minutes at least.
Oh, 4 minutes. Wow. Okay.
Yeah. 4 minutes, then you really disinfected and inactivated everything on that surface.
Okay. So with the paws, can you just leave the vinegar on the paws, or should you wipe them down?
No, I would with the paws. It's a different situation because they are porous and you can get away with less surface time. I'm talking about hard surface fomite, like a marble or a table or something like that. So just to make sure, well, did I, inactivate everything or not? And your gauge should be 4 minutes of. I can see it's wet for 4 minutes before it dries, then you really did a good job on disinfecting that surface.
Okay, so people just remember that pets are not the cause. They are not necessarily carriers. Everything is susceptible to having COVID-19 or the virus that creates COVID-19 condition on it. So think sensibly, don't panic. Just remember to wipe everything down when you come in. If you have a garage, come through the garage, have some spare clothing somewhere that you can just have in a closet or nearby hanging up that you can, wipe down your hands, take off your jackets and everything, wipe down your hands again, or stick everything into a plastic bag, seal it. It sounds crazy, but it can become a game, even for family, where it's like a ritual, just a lot of cultures have the ritual of taking your shoes off and washing your hands before you go into a house. It's not a bad ritual to have. So, maybe just consider that.
One last thing on, we don't recommend at this point. A lot of people buzzing about, should I get my pet tested?
Right.
No, we don't. At this point, we are not recommending any testing for pets. If your dog or cat is showing upper respiratory tract sign, contact your vet. And they're doing a lot of telemedicine now to try and give you an advice, which is really good way to avoid spreading the virus to us and us come in contact with the pet owners and, vice versa. So come in contact with your vet and they can do telemedicine consult. Typically what I recommend, even for other veterinarians, this is what we recommend. Rule out other causes of upper respiratory tract infection before we instill panic in people, kennel cough and bronchitis and asthma and just simple cold. And you can test for that. If you suspect as a vet or if your pet has been treated and suspected, he has not responded, then you should call the health department. And the health department typically have contact with the USDA in the US, which is the United States Department of Agriculture. They have a designated veterinarian. Regular veterinarians are not allowed to just test. If you get a case that is suspicious, they have to call the USDA accredited veterinarian. They have to have protective gear and test that particular patient. So my point is, first of all, we don't recommend testing.
All right. Well, thank you so much, Dr. Akawi. We will definitely know now that the way to prevent infection is to be sensible and take precautions. And now people know what sort of things they can use on surfaces and separately cats and dogs. So with that in mind, thank you so much. And we will continue to have updates as we are updated ourselves on procedures and precautions, etc. So thank you so much. And once again, bone broth, which is what you were saying for humans, is just as good for animals. Bone broth is an excellent way to keep their immune system healthy and well.
Especially if you add turmeric to it. Now we learned today it stimulates your NRF2 pathway, so you can get anti-inflammatory and block your interleukin-6 activity.
Okay, and even pets can have turmeric as well, right?
Yes,
so
yes.
a little tiny bit. I mean, obviously check the dosages. Where is a good place for people to know what kind of dosages their pets can have of like?
There is actually they have PetMed.
Okay, PetMed. Okay,
yeah.
Cool.
PetMed has it's almost the cousin of the medical website. Yeah. So PetMed has a lot of information you need about dosages.
Okay, perfect. Thank you so much, Dr. Akawi.
All right, thank you. Pleasure.
Are you ready for life-saving and life-changing hacks?
Was ist das?
20 minutes of the best top expert tips and hacks to make your life better. Life hacks. Technology, business, multimedia, wellness and health, events, reviews, and more. Life hacks. Every Sunday at 7 p.m. Life hacks. Lifehacks.com. That's with a K and an X on Radio X.